Welcome to Rwanda Medical Academy. Today's lesson is about the aetiologies of sinus bradycardia. And we will use the same word mnemonic, sinus bradycardia, to help remember well all those etiologies. Now let's dive into the critical and fascinating world of sinus bradycardia. This topic is a cornerstone in health science, an intriguing rhythm of the heart that doctors, nurses, and health enthusiasts alike find incredibly important. Sinus bradycardia is a slower than normal heart rate, and it can be caused by various factors from aging to certain medications. But how can we remember all these causes? Well, we have got a clever mnemonic for you. Sinus bradycardia. Each letter stands for a different cause, making it easier to remember these crucial points. As we delve deeper into this topic, we'll explore each cause in detail, demystifying this complex condition. By the end of this lesson, you'll have a comprehensive understanding of sinus bradycardia, its causes and implications. Understanding these causes can aid in accurate diagnosis and effective treatment. Coming to our mnemonic sinus bradycardia, first the S in our mnemonic stands for sleep. Now, let's delve into how sleep can contribute to sinus bradycardia. As we transition into sleep, our bodies enter a state of rest and relaxation. This change involves a shift in our autonomic nervous system, from the sympathetic fight or flight response to the parasympathetic rest and digest mode. Consequently, our heart rate tends to slow down. Now, in some individuals, this slowing down can be more pronounced, leading to a lower than normal heart rate or sinus bradycardia. It's important to note that this is generally a physiological response and not necessarily a cause for concern. However, if a person already has a heart condition, or if the slow heart rate is accompanied by other concerning symptoms, it could indicate a problem. So a person's sleep cycle can indeed impact their heart rate. Moving to the I, which represents infections, specifically myocarditis. Myocarditis is an inflammation of the heart muscle, often resulting from a viral infection. This inflammation can affect the heart's electrical system, leading to a slower than normal pulse or sinus bradycardia. Now, picture the heart muscle as a bustling city, with electrical signals acting as its traffic control system. In the case of myocarditis, the traffic lights are on the fritz, causing cars, or in this case, electrical signals to move slower than usual. This disrupts the heart's normal rhythm and leads to a slower heartbeat. It's also worth noting that myocarditis can also cause other heart rhythm disturbances, not just sinus bradycardia. These may include tachycardia or a fast heartbeat, and arrhythmias or irregular heartbeats. So infections like myocarditis can have a profound impact on our heart's rhythm and rate. Infections therefore play a significant role in heart rate regulation. Next, the N stands for neap thyroid or hypothyroidism. The thyroid gland, although small, plays a significant role in the body's metabolism, including the regulation of heart rate. When the thyroid gland becomes underactive, a condition known as hypothyroidism, it can lead to a slower metabolic rate. This slowdown can also affect the heart rate, leading to sinus bradycardia. In hypothyroidism, the heart muscle becomes less sensitive to the action of adrenaline, which is a hormone that normally increases the heart rate. As a result, the heart rate slows down. In addition, hypothyroidism can increase the level of cholesterol in the blood, which can lead to the development of atherosclerosis, a condition that can further slow the heart rate. So, if you're experiencing a slower heart rate and you've ruled out other causes, it might be worth checking your thyroid function. The thyroid, while small, can have a large impact on heart rate. The U in our mnemonic stands for unconsciousness, particularly vasovagal syncope. This condition is a common cause of fainting, where there's a sudden drop in heart rate and blood pressure leading to a temporary loss of consciousness. The heart, in this case, slows down due to a miscommunication between the brain and the heart. Here's how it works. During a vasovagal syncope episode, your body reacts to certain triggers, such as the sight of blood or extreme emotional distress. The heart rate slows, and the blood vessels in your legs widen. This allows blood to pool in your lower limbs, which means less blood is available for your heart to pump to the brain. The result? A temporary loss of consciousness, or fainting. This slowing of the heart can result in sinus bradycardia. As we see here, the body's response to certain conditions can inadvertently cause sinus bradycardia. The second S in our mnemonic represents subnormal temperatures or hypothermia. It's fascinating how our bodies respond to temperature changes. When we're exposed to cold environments, our bodies aim to conserve heat. One way it does this is by slowing down the heart rate, resulting in sinus bradycardia. A slower heart rate means less blood is pumped throughout the body, reducing heat loss. It's a clever survival mechanism, but it's not without its risks. Sinus bradycardia can result in symptoms such as fatigue, dizziness, and fainting. In severe cases, it could lead to heart failure or even death. So, while our bodies are incredibly adaptive, they're not invincible. If you find yourself in a cold environment, it's paramount to keep warm, to prevent hypothermia and the associated risks. Cold environments, therefore, can have a chilling effect on heart rate. Now, B stands for biliary obstruction. Biliary obstruction or blockage in the bile ducts can lead to a variety of health complications, including sinus bradycardia. You may wonder, how does a blockage in bile ducts affect heart rate? Well, let's break it down. Biliary obstruction can cause a buildup of bile in the liver, leading to jaundice and other systemic effects. One of these is a change in heart rate. The body, in an attempt to compensate for the liver's distress, may slow the heart rate, resulting in sinus bradycardia. This is a perfect example of how interconnected our body systems are. A problem in one area, like the liver, can ripple out and affect seemingly unrelated systems, such as the cardiovascular system. So even seemingly unrelated health issues can impact heart rate. It's a reminder of how vital it is to consider the whole body when diagnosing and treating health conditions. The R in our mnemonic stands for raised CO2 or hypercapnia. Now, what does this mean in relation to sinus bradycardia, you might ask? Well, let's take a closer look. When there's an excess amount of carbon dioxide in the bloodstream, it's known as hypercapnia. This condition can occur due to a number of reasons, such as hypoventilation, lung diseases, or even environmental factors. So how does this lead to sinus bradycardia? The answer lies in our body's intricate mechanisms to maintain homeostasis. When CO2 levels rise, our body responds by slowing down the heart rate to reduce oxygen consumption and carbon dioxide production. This compensatory response can result in sinus bradycardia. This is why conditions like chronic obstructive pulmonary disease, which lead to raised CO2 levels, are often associated with bradycardia. Our respiratory system, it turns out, plays a key role in heart rate regulation. The A in our mnemonic represents acidosis. Now, acidosis is a condition characterized by an excess of acid in the body fluids. This can occur as a result of respiratory issues, kidney disease, diabetes, or even excessive alcohol consumption. But how does this relate to sinus bradycardia? Well, the heart relies on a precise balance of chemicals, including hydrogen ions, to maintain its rhythm. In an acidotic state, there's an overabundance of these hydrogen ions, disrupting this balance. This can slow down the electrical impulses that regulate heart rate, potentially leading to sinus bradycardia, a condition where the heart beats fewer than 60 times per minute. Acidosis isn't the most common cause of sinus bradycardia, but it's an important one to be aware of, particularly for individuals with underlying health conditions that might predispose them to acidosis. Remember, our bodies are finely tuned machines, and even small changes can have significant impacts. Maintaining a balanced pH is crucial for a healthy heart rate. The D stands for deficient blood sugar or hypoglycemia. This is a condition when your body's sugar levels drop below what is necessary for normal function. It can happen for several reasons, such as not eating enough, taking too much insulin or other diabetes medications, or even excessive exercise. But how does it relate to sinus bradycardia? Well, the body responds to low blood sugar levels by releasing adrenaline, which is a hormone that boosts the heart rate. However, if the hypoglycemia is prolonged, the body might exhaust its adrenaline reserves, leading to a slower heart rate, or sinus bradycardia. Additionally, low blood sugar can also cause the release of other hormones and chemicals that can slow down the heart. It's a bit like the body hitting the brakes when it realizes it's running on empty. Blood sugar levels then have a direct effect on the heart rate. Next, I stands for imbalance of electrolytes. Electrolytes are minerals in your body that have an electric charge. They are essential for many bodily functions, such as maintaining the balance of fluids, regulating your heartbeat, and allowing muscles to contract. When there's an imbalance in these electrolytes, it can lead to various health issues, including sinus bradycardia. When the levels of key electrolytes, such as potassium or calcium, become too high or too low, they can affect the electrical impulses in the heart, causing the heart rate to slow down, a condition known as sinus bradycardia. In particular, hyperkalemia or high potassium levels can cause the heart rate to slow and even stop, if not treated promptly. Furthermore, certain medications used to treat other conditions can also disrupt the balance of electrolytes and lead to sinus bradycardia. As we see, maintaining balanced electrolytes is vital for heart health. The C in our mnemonic represents Cushing's reflex. This reflex is a physiological response to increased intracranial pressure. The body reacts by escalating blood pressure to maintain cerebral perfusion. But what's the link to sinus bradycardia, you may ask? Well, the body, in its wisdom, responds to this surge in blood pressure by slowing the heart rate, a phenomenon known as reflex bradycardia. In cases of severe brain injury or conditions that lead to a significant rise in intracranial pressure, Cushing's reflex kicks in, and the resulting bradycardia can be profound. It's a complex interplay between the heart and the brain, a delicate balance designed to protect the brain from damage. However, it's important to note that Cushing's reflex is often a late sign of significantly increased intracranial pressure and can indicate a medical emergency. The body's responses to stress, therefore, can influence heart rate. The A stands for aging. As we journey through life, our bodies undergo numerous changes, and the heart is no exception. Aging can contribute to sinus bradycardia, a condition characterized by a slower than normal heart rate. As the years go by, our heart's natural pacemaker, the sinus node, may lose some of its cells. This loss can cause the heart rate to decrease, leading to sinus bradycardia. The condition is more common in older adults and can result from the natural aging process or from diseases that damage the heart's electrical system. However, it's important to remember that not all instances of sinus bradycardia in older adults are a cause for concern. In many cases, a slower heart rate can be a sign of good health and efficient heart function, particularly in those who are physically active. As we age, our heart rate can naturally decrease. The R in our mnemonic stands for RX, or drugs. Certain medications, such as high-dose atropine, can indeed lead to sinus bradycardia. Atropine, for instance, is a medication that is often used in the treatment of certain heart conditions. But when used in high doses, it can paradoxically slow the heart rate, causing sinus bradycardia. This happens due to the drug's action on the parasympathetic nervous system, which can decrease the heart's automaticity and slow down the conduction of electrical impulses. Other drugs like beta blockers, calcium channel blockers, and some types of antidepressants can also cause sinus bradycardia. It's essential to keep in mind that while these medications are beneficial for treating various conditions, they can also have side effects, and their use should always be monitored by a healthcare professional. Medications, as we see, can have a significant impact on heart rate. The D stands for deep anesthesia. Deep anesthesia, a state of profound unconsciousness, is a critical tool in the medical field, facilitating surgeries and other invasive procedures. However, it's not without risks. One of these is sinus bradycardia, a condition where the heart rate drops below 60 beats per minute. When a patient is under deep anesthesia, the body's autonomic nervous system, which controls heart rate, can be significantly suppressed. This can lead to a reduction in heart rate, a phenomenon known as anesthesia-induced bradycardia. This condition can be particularly concerning in the context of surgeries, where stable vital signs are crucial. While this is generally a reversible condition, it requires careful monitoring and management to prevent further complications. In some cases, medication may be needed to increase the heart rate. Anesthesia, therefore, must be administered with careful consideration to heart rate. The I in our mnemonic represents ischemic heart disease. Ischemic heart disease also known as coronary artery disease, is a condition where the heart muscle doesn't get enough blood due to blockages in the coronary arteries. These blockages are typically caused by the buildup of cholesterol, fat, and other substances, which form a plaque in the arteries. Now, how does this lead to sinus bradycardia? When the heart muscle is deprived of oxygen-rich blood, it can affect the sinus node. This node, being the natural pacemaker of the heart, regulates the heart rate. When it's impacted by ischemia or lack of oxygen, it may not function properly, leading to slower heart rates, a condition we call sinus bradycardia. It's important to understand that ischemic heart disease is a serious condition that requires medical attention. It's not just about a slow heart rate, it's about the overall health of your heart. Heart disease, as we see, can have a profound effect on heart rate. Finally, the A stands for athletes. Now, this may seem counterintuitive. Aren't athletes supposed to have strong, healthy hearts? Absolutely. But here's the twist. In many cases, athletic training can lead to a condition known as athletic heart syndrome, a form of sinus bradycardia. This happens because as athletes train, their hearts become more efficient at pumping blood. Over time, the heart muscle strengthens and enlarges, which allows it to pump more blood with each beat. Consequently, the heart doesn't need to beat as often, resulting in a slower heart rate or bradycardia. It's important to note that this is typically not a cause for concern. In fact, it's a sign of excellent cardiovascular fitness. However, it's always crucial to monitor any changes in heart rate, especially for those who are involved in rigorous physical training. Physical fitness, it turns out, can impact heart rate significantly. Let's bring it all together now. Sinus bradycardia, a condition marked by a slower than normal heart rate, can be attributed to a variety of causes. We've discussed these in depth, using the mnemonic sinus bradycardia as our guide. Sleep is a natural state that can slow down our heart rate, causing sinus bradycardia in some cases. Infections like myocarditis, an inflammation of the heart muscle, can also trigger this condition. Neap thyroid or hypothyroidism, a condition where the thyroid gland doesn't produce enough hormones, is another key player. Unconsciousness, particularly vasovagal syncope, a sudden drop in heart rate, and blood pressure leading to fainting, is another cause. Subnormal temperatures or hypothermia can slow the body's metabolic processes, including heart rate, leading to sinus bradycardia. Biliary obstruction, a blockage in the tubes that carry bile from the liver to the gallbladder and small intestine, can also cause this condition. Raised levels of carbon dioxide in the blood, or hypercapnia, and acidosis, a condition characterized by excessive acid in the body fluids, can both trigger sinus bradycardia, deficient blood sugar or hypoglycemia, and an imbalance of electrolytes, key minerals that help balance the amount of water in your body and maintain a healthy pH level, can both contribute to a slower heart rate. Cushing's reflex, a physiological nervous system response to increased intracranial pressure, can cause sinus bradycardia. Aging, too, can slow the heart rate as the heart's natural pacemaker, the sinus node, loses cells. Certain drugs, like high-dose atropine, can slow the heart rate, as can deep anesthesia. Ischemic heart disease, a condition where the heart muscle doesn't get enough blood due to blocked arteries, can lead to sinus bradycardia. Lastly, athletes, who typically have a lower resting heart rate due to increased cardiovascular efficiency, can experience this condition. Armed with this knowledge, you're better equipped to identify and understand sinus bradycardia. Thank you for learning. Join and save lives with us at Rwanda Medical Academy.